We are Makilala TV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
As a baby boomer and fitness coach, I meet a lot of people who suffer from aging-related injuries and accidents. One of the treatment options generating a lot of excitement is stem cell therapy. What is stem cell therapy? Is it legal in the US? Is it covered by insurance? Are there ethical issues to consider? Are there different types of stem cells that are used to heal the body? Can it cure cancer, MS, or Parkinson's? There are so many questions to answer, and hopefully today we will get some answers and gain more understanding of this potentially powerful technology. I'm Jen Fuhrer. Together with my co-host Rachelle Ocampo, we welcome you to Makilala TV. Joining us in the discussion as guest co-host is Lenn Almadin-Thornhill, an assignment editor with Fox News, handling national and international news. He is also a freelance producer and reporter covering politics and breaking news for ABS-CBN. And when not on assignment, Lenn is a girl who tells stories about sun, sand, and drinks. Our featured guest speaker is Bima Baje. Bima was born in the Philippines and migrated to the US in 2003. This mother, accountant, wife, and school business administrator is the co-founder of Colts Stem Cells and Regenerative Medicine, which offers stem cell therapy for joints, neuropathy, wound healing, and to provide an alternative therapy for treating over 120 autoimmune diseases. Everyone, welcome to Makilala TV.
Thank you.
Okay, first of all, thank you all for coming here. Really appreciate it. So Bima and Lenn, welcome to Makilala TV.
Thank you.
So my first question, what is stem cell therapy?
Okay, first of all, thank you for having me here. Yes, stem cell therapy is a cutting-edge technology which uses stem cells to treat conditions with degenerative, due to degenerative diseases or injuries. So what stem cells would do is fight the inflammation and regenerate tissues, repair tissues that is damaged caused by degenerative condition. Or if it's because of the injury, it would repair the damaged tissues and cells around it.
So let's say you have aches in your shoulder and you did all the therapy already that's necessary, whether it's physical therapy, and you still have the pain. So one of the options that the doctors advise the clients is to do stem cell therapy?
First of all, you have to have because we don't diagnose, so we have to see the X-ray and the MRI results. What is the cause of your pain? Because the stem cell therapy would address the cause of the pain, not only mask the symptoms that you're having. So if it's because of the degenerative condition or because of the injury, stem cells would address it, as long as it's not alignment issue. Because there's like disc, like if you have slip disc and there's like needs to be realigned, even though you like inject stem cells into it, if there's a problem with the alignment, stem cells won't help.
What's the benefit of going to somebody like you instead of getting it treated or fixed in the hospital or their
surgery?
Surgery, you can go anywhere as long as you're comfortable. Because this is not covered by insurance in the first place.
It's not.
So this is just an option.
Okay.
Veterans Hospital actually is using it already.
Right.
We partnered it with the AvCare. Because Colts Stem Cells is not just a regular stem cell clinic. We provide stem cells. We supply stem cells over the country and 16 other countries. So
when you say you provide, you harvest the stem cells?
We supply.
Okay.
So we're not only just treating. We're not just the clinic who's just treating patients. We provide. We supply stem cells over the country, over whoever wants to have treatment.
Okay.
So how do you like get stem? Where does it come from other humans?
Okay. First of all, we have to discuss about different types of stem cells, so you would understand what are the sources of that. We have embryonic stem cells, which is from aborted fetus, which is not, we don't use it. It's only more on science research. We have postnatal stem cells, which is the placenta and umbilical cord.
From the umbilical cord.
And we have also the adult stem cells, which is, we can get it from fats, bone marrow, and teeth.
So people actually donate that?
Can you use your own fat?
Yes, we do.
To get your own stem cells?
Yes.
Oh.
You can do the liposuction, then spin it, just extract the stem cells and put it back.
So your supplies, where they come from?
Umbilical cord.
Umbilical cord.
Yes.
I'm sure the next question everybody is thinking, who volunteers umbilical cord? Where do you get them? Do you buy them?
We don't buy them. It says our laboratory is in California. We have relationship with local hospitals where, if we have pregnant women, if they opt in of donating their umbilical cord.
Oh yeah, I remember that, because when I was pregnant with my 4th kid, I got this literature saying if you want to deposit your umbilical cord.
That's a different.
Oh, that's a different thing.
That's a different thing. You can store your umbilical cord and use it in the future. So you have to pay for storage fees, and you don't even know what's in there until they process it in the laboratory. This one is different. It's if you're pregnant, and if you opt to donate your cord blood instead of discarding it, because you discard it anyway. So if you opt in for donating it, then our technician will just extract the blood from it and the tissue, because we use the tissue, the blood, and the Wharton's jelly to process it to come out stem cell. So once we have that, once the mother would opt in to donate it, then we start the process of screening. Because you have to be screened to make sure that you don't have any
genetic testing and stuff like that.
It's not genetic testing, but it's more on screening if you have any communicable disease.
I see.
So we make sure that we don't. We don't have the
what is more effective, using your own stem cells or using somebody else's stem cells? Is there like a different?
It varies. Like say if you're like in the science, as you age, your number of stem cells slows down because of the mitosis. So when you're a baby, the stem cells divides every 28 hours. When you're 50, it divides like every 48 hours. So now, if you have problems with degenerative diseases, like you have knee problems, you lose your cartilage, it's supposed to be stem cells because you already have the stem cells. That's the job of the stem cells. It's a tissue turnover, and the stem cells will turn into specific cells or tissues that's needed, but you don't have enough of that because your stem cell counts don't have that anymore. So I would, based on our experience, you could use your own stem cells or you could use umbilical cord stem cells. However, if you use your own stem cells, you need millions of those.
Why is that?
So you do not. You don't produce enough for it to be.
So, but we can still provide that. You get extracted, fats. You can get it also from your bone marrow, but bone marrow is more painful. And you have also, like in the research says that you have a risk of having cognitive decline or any risk of having dementia in the future.
Oh,
yes.
So that's people should know that when you take it from you, there are some side effects.
Yes, and then fats, it's like a little invasive. You would see the big needle. To me, I don't like it, but for the heck of it, I will.
Okay, I want to ask you about the success rate, but before we do that, we have a short video from one of your clients who talked about a procedure that he did with Colts Neck Center.
Sure.
Experience was wonderful, no pain whatsoever with the injection, the easiest thing I've ever done.
So she mentioned injections. So how do you get stem cells into your body? You inject them? Do you take a pill? In her case, she had some injection.
So in her case, I think she's 75 years old.
Okay.
We did injections from an umbilical cord. So the product comes in a vial. It's frozen, and it gets thawed. After 5 minutes, we inject it to her. So it's just like normal injection.
Just like getting a flu
vaccine,
shot?
yeah.
Just put it in directly to the affected area.
Okay.
There's like a.
And I'm assuming depending on the severity of the injury or the situation, that depends on how long they get treatment, and then is it finished after what it regenerates itself?
Not necessarily, because for joint injections you only need one. You only need one.
One.
Really?
Okay.
Really?
And
so
then they're
one
healed?
shot and they're really?
Wow.
Based because I am the one because I'm hands-on, so that's why like I have to run after this. I have to run because we have so much book today. I'm the one who talked to the patient directly pre and post procedure to make sure that everything is being done properly, along with my husband, who's also he's a pharmacist, and we're also working for the stem cell company and also our medical director. So when we do it, I make sure that we educate the patient to know exactly what they're getting. And before that, there's going to be precautions that they need to do before the procedure, because there's a lot of problems in the stem cell therapy that it didn't work because it's not because of the stem cell itself, but because of there are procedures that was not done properly. Like for example, so they cannot drink alcohol, they cannot drink any, they cannot take any medications like any anti-inflammatory, because that's contraindication for the stem cells, because the stem cells is supposed to be the anti-inflammatory.
How about like autoimmune disease, like rheumatoid arthritis?
Autoimmune disease, it's a different type of procedure that we do. It's not injection directly, it's done through IV. So what the stem cells would do is would reset your immune system.
Wow.
Because what it is, the RA is type of immune problem that will fight your own. It will fight your own your antibody, because we have antibody already that fights our own cells. So in the case of the RA, it would fight your own joints so that you would see the symptoms.
I mean, you mentioned earlier, or maybe one of your posts, that some of your clients have Parkinson's.
Yeah.
I mean, what's the success rate of someone who has Parkinson's?
Success rates, it varies, because we just started in our clinic. We just started the Parkinson's disease. I cannot say like the percentage of the doctors that we supply stem cells with, but I would say generally they have high success rate, but I cannot speak for them.
Right.
So I'd rather have it, from our own clinic, because I see them all the time.
Right.
So I'm the one, directly connecting to the patients.
I have a practical question. I know you say it's not covered by insurance. And obviously everybody wants a quick fix. So it sounds like, if I have a injury or something, I want to get fixed up. Can you talk about generally how much it will cost? Like for instance, any, a minor one, a joint issue or something.
One joint injection is like $5,000.
Wow.
Yeah.
That's one time, Lenn.
I got you covered.
Is there a payment plan?
Yeah, $5,000. But if you compare it, like say especially if you're working, okay? If you're working and let's say average, you're making $60,000 a year and you get knee replacement. So as we know, disability coverage, you only get 60% of your salary. So if you are having knee replacement and you're out of work for like at least 6 months, how much do you think you would lose?
Right.
Compared to the $5,000 that you pay for the injection.
Right.
Yeah.
Okay.
So if you do the math, you don't have any downtime for the injection.
I guess you're in so much pain, right? That you need a
Right.
solution. What kind of clients, what kind of people come to you for help?
People who did, they already did so much, they have treatment procedures that were not successful. Like they have the pain due to injuries for like how many years already, and they've been just managing the pain because it's not really addressing the issue. So they did hyaluronic acid injection, or they did cortisone shots. Cortisone shots, it's not addressing the pain, it's just masking the symptoms, but it wears off after a few months. And also there's a that side effect of that.
Okay.
It would damage your bones.
Are there side effects of taking stem cells when you don't need it? Let's say you have a pain.
No.
No?
It's anti-aging actually.
Oh.
We have a lot of we have a lot of
You should have led with
that one.
yeah, we do a lot of just anti-aging. They just want to
wrinkles?
Yes.
Really?
We can do we can use aesthetics instead of Botox. You can use stem cells.
Really?
Oh.
Because Botox is toxin.
Oh, that's interesting.
Yes. So it can when you inject the stem cells in your face, it would help produce collagen.
Is it
Natural.
possible they inject it and someone has a negative reaction to it?
Negative reaction is like maybe because it could be from the stem cell itself that is infected. That's gonna be the risk, but no.
How do you make sure that aside from signing the dotted line that that you're not liable? How do you make sure that you're getting the right stem cells, that you're the good quality stem cells?
Oh, first of all, it has to be from a laboratory that is being regulated by FDA.
So is it FDA approved?
It's not FDA approved because FDA approval is for indications. Indications is only for we have for the cord blood stem cells, or any stem cell therapy is only for blood disorder. But other indications is still considered as off-label use. But the process itself, when you from the dates harvested to the process, once it's processed in our laboratory, we process it after the screening, right? And then we process it in the laboratory before we send it to any clinics that orders the product. We have to submit it to the third-party laboratory, which screen the efficacy and the viability and the sterility of the product to make sure that it's very safe.
But now, say I'm a new consumer and I'm looking into stem cell. How do I know it's a legitimate, doctor's office?
Yeah.
Like, how do I know that they are certified in certain things? What should I be looking out for?
You have to see the source of the product to make sure. The laboratory.
Is there a website you could double check whether, let's say, Colts, it's rated?
Yeah, you
by
have
the
to look for the FDA. There's a website that you can see who are laboratory, who are legitimate laboratories that are regulated by FDA, and make sure what type of stem cells you're getting. It could be from fats, or it could be bone marrow, or umbilical cord, because a lot of stem cell clinics does that. Make sure that you don't just get the PRP. PRP is different.
What's PRP?
PRP is it's from your blood and spin it and then inject it to you.
Oh, wow. Have you dealt with any cases where you had to turn away or turn down patients, clients?
Yes.
Yeah.
Because we don't, we don't want patients who are not really into it 100%, because we don't want to be blamed for anything. Because it could be there could be a reaction, and there could be a reaction caused by something else.
Like they want to drink,
and then they
will blame on you.
Yes.
Right. Okay.
And also we make sure before we get the treatment, we have to educate them.
Right.
Are you really willing to do this? If you're willing to do this, you have to follow all these precautions, because stem cells would work, especially those alcohol, smoking. You should not be doing that.
So you have to live a healthy lifestyle when you're going through stem cells.
So if for instance, I come in but I'm already on medication for, depression or something else.
As long as it's not indication for stem cells, especially those anti-inflammation.
Okay.
So like if we have a case of autoimmune disease patient where she was taking what's that, antibiotics, she should stop.
So you can't have multiple medication
No, you can.
Only up to the treatment, when you're getting the treatment. Then
Before.
afterwards.
Before and after.
All right. Then
Like, so
afterwards
like
you can.
3 months.
Okay. Oh, 3 months. Okay.
3 months.
So the important thing is really just get consultation.
Yes.
See if you're eligible. Similar to like if you wanted to get LASIK, like you want to make
Yeah.
sure that your eyes are eligible for the procedure.
Yes.
So similar.
So we make sure that we have that, because like others, like, because it could be psychological, like, oh, somebody feels like this and I feel pain too. Like maybe I can maybe I can do
see.
this too. Like no, it's
Right,
not like that.
We are running out of time.
Oh.
There's so much to know, but I guess we have to tell our viewers that they have to do a lot of research and that this is an option. But like any other option, you have to be aware of the positives and the negatives.
Yes.
And is there anything you want to tell the audience about your?
Yeah, for all the the people out there that are looking for options other than drugs, stem cell therapy is available, but you make sure that the clinic that you're going to is legitimate, and you check their procedures, that make sure that there's free of sterility issue, because you're getting a cell that's that's a biologic product that is coming from, could be from you or could be from other donor, but we're talking about like the could be infected.
Yes.
So it could be coming from you and the procedure is being done wrong. It could be exposed to infection. So
that's so much. Yeah.
So much to know.
So much information. Thank you so much, really, for taking time. And you opened another clinic in Manhattan.
yes,
right?
we just opened our clinic in Lexington Avenue. It's between the 39 and 40th. And we're so excited about it.
Thank
and
you.
to those patients who doesn't want to drive to Colts Neck, because we are
All the way far away.
we are in a farm area,
Okay.
but it's worth it if if you're in pain and you want to save a little money to have that treatment, because it's here it's expensive. So
Thank you. And Lenn, thank you for being
Thank
here too.
you.
Nice
Thank
having
you.
you back. And I can believe that's it for our panel.
thank you for having me here.
Yes, thank you.
It's
So
an
much
honor.
information. You'll get her information, Bima's information, on our website. Thank you all for gracing our show. And to our viewers, thank you for inviting us to your homes, and hopefully you'll learn something new. As always, let's remember to be kind, be true, be fierce, and do things that tickle your heart. And remember, think positive. To the cast and crew, maraming salamat. Thank you. Before we say till next time, performing for us today is singer-songwriter Giselle de los Santos, singing her original composition, Can't You Stay in Love. Let's all give Giselle a warm round of applause.
I'm trying to be honest. I'm trying to be serious with you. I wanna tell you things from deep inside. I hide. Ooh. In my mind, I am yearning. Baby, I am. 'Cause baby, now I have lost you somehow. I wanna tell you things from deep inside. I'm sorry, I know you've had enough, but babe, you're all I have. Don't walk away from me, please. Why can't you be the one? Why can't you see my worth? Why can't you see? Why can't you realize that I'm yours? Baby, I can be yours forever. Can't you stay in love? Stay in love. different worlds. I wanna make it up and hold you close right now. I know you've had enough, but babe, you're all I have. Don't walk away from me, please. Why can't you be the one? Why can't you see my worth? Why can't you see? Why can't you realize that I am yours? Baby, I can be yours forever. Can't you stay in love? Stay in love. But